Access your eyes. You can just look at me. Okay. Okay. And then we'll get you to look at this. I'm going to take it to your nose and you just look at it. Okay, and then look at it. I'm going to do it this way. Just follow it. Okay, so I assess Perla. Your pupils are equal, round, reactive to light, and the accommodation's normal. I can tell that they are equal bilaterally. Your conjunctiva is pink, your sclera is white, your cornea is clear. So that's good. Take a look at your nose. Look up for me. Okay, I don't notice any redness or anything. You don't have a deviated septum, no lesions or anything. They are bilaterally symmetrical. Okay, can I get you to blow out and then do the other side? Okay, so your nares are patent. Your airway's clear. So now I'm also going to look inside your mouth. You open up. Say ah. Okay. So your oral mucosa is pink and moist. Your teeth are intact. And I didn't see any lesions or ulcers or anything, so that's good. Your lips are pink, so that's good too. Okay, so now I'm going to take a look at your ears. See if you get any pain. Any tenderness? No. And I don't see any redness, lesions, or anything. Good on that, and they're symmetrical with your face. Okay, so now I'm going to take a look at your neck. Just look up for me. Okay, your skin is intact. It's the appropriate color for your age and ethnicity. I don't see any lesions or anything, any scarring, bruising. Your trachea is midline. Okay, now I'm going to listen. I'm going to feel for your pulse. Carotid pulse. Okay. Okay, so those are equal bilaterally. I give it a +2, which is regular. All right, now I'm going to listen for a bruit. So I'm going to get you to just breathe in and keep it in. And I'm going to listen to it with the bell of my stethoscope. Okay. Okay, then breathe out for me. And then one more time. Okay, so no carotid bruit noted, which is good. I don't see any jugular vein distension, any JVD noted. So that's good. For privacy reasons, she's not going to take her shirt off, but I would make sure her skin is appropriate for her age and ethnicity on her chest. I would look for lesions or any bruising or scarring. Also, she's warm, so that's good. So now I'm going to listen to your heart. I'm listening in 5 places. So I'm going to start here, which is going to be your aortic, and that's going to be your on the right sternal border, the second intercostal space. Moving over here is going to be your pulmonic in the second intercostal space, left sternal border. Moving down, I'm going to do your herbs point. Move about right there. That's going to be your third intercostal space, left sternal border. Moving down a little bit more is going to be your tricuspid, and that's going to be left sternal border, fourth intercostal space. Right about right here is your mitral, and that's going to be mid-clavicular line, fifth intercostal space, okay? And then I will assess that for 1 minute for your apical pulse. so I got 82 beats per minute, so that's within the normal range, so that's good. I'm also going to listen for some lung sounds, okay? But also with your heart, I heard S1 and S2 sounds. I didn't hear any murmurs, clicks, any gallops, anything like that. So that's good. So now I'm going to listen to your lungs. And each time I move the stethoscope, just breathe in and out for me, okay? Okay, so your anterior lung sounds and all lobes equal bilaterally. Everything was clear. I didn't hear any avitition sounds. No. Normally I would auscultate on your direct skin for that, but since for privacy reasons, you know, we kept your shirt on. So now I'm going to get you to lay down for me. Okay, I'm going to assess your abdomen. So just by looking at it, your abdomen is contour, it's not distended, it's flat, it's your skin color is intact. Your skin is intact and your skin color is well appropriate for your age and ethnicity. I don't see any lesions, any redness, nothing like that, okay? So I'm gonna listen. The first thing I'm gonna listen for, your bowel sounds starting at the right lower, going into the left lower quadrant, and then I'm also going to listen for a bruit right about right here, okay? Okay, so with your bowel sounds, they were active in all 4 quadrants. I didn't hear any abnormality sounds. And then with the bruit, I didn't hear any bruit, so that's good. I'm just gonna palpate. Let me know if you feel any tenderness or any pain. Okay. All right, and for privacy reasons, I'm not gonna get your femoral artery, your pulse, but I would do it about right here, and normally it would be bilaterally equal, regular plus 2, okay? I'm also gonna check for your skin on your legs is intact. I don't see any lesions or redness or anything, no edema, so that's good. Your skin color is appropriate even throughout. I'm going to check capillary feel in your toes. Okay, so that's equal bilaterally and it's less than 3 seconds, so that's good. I'm going to check your pulse. Dorsalis, Pedis. Okay, it's even bilaterally plus 2 and regular. Okay, and your posterior tibial is plus 2, bilaterally equal and regular, so that's good.
I don't feel any like lumps, bumps, or lesions or anything. I'm also just like looking to make sure that there's no infestations or anything like lice or something like that. And she looks good. Her hair is, she has thick hair, it's evenly distributed. I didn't notice like any like bald patches or anything, which is good. And so now I'm gonna go ahead and palpate your temporal artery, okay? Feeling, there it is. And then her temporal artery is 2+, which is good. And I'm gonna go ahead and palpate your temporal mandibular joint. There it is. Can you open and close your mouth? Again. Good. I didn't feel any like popping or scraping or anything, which is good. And then, so right now I'm gonna go ahead and test your cranial nerve 5, which is the trigeminal nerve. So what I want you to do is go ahead and clench your jaw. And then I'm gonna just feel her temporal and her muscles. And they're like even, they're symmetric on both sides. And then I'm gonna put my hand underneath your chin, and I just want you to open up against resistance, okay? So go ahead. Good. And then one more thing I'm gonna do. I have a little napkin. I'm gonna have you close your eyes, and then I'm just gonna lightly swipe on different parts of your face. And then when you feel it, I just want you to say yes and let me know that you feel it. Okay, so go ahead and close your eyes.
Yes.
Good.
Yes.
Good.
Yes.
Okay.
Yes.
Mm-hmm.
Yes.
Good.
Yes.
Okay, good. So we can go ahead and assume that her trigeminal nerve, cranial nerve 5 is intact. So now I'm gonna go ahead and palpate your lymph nodes. It's gonna be just like your facial and like your neck area, and then just let me know if like you feel any tenderness throughout this, okay?
Okay.
So firstly, I'm gonna start with the preauricular, good, postauricular, okay, occipital, and then submandibular, submental, okay, tonsillar, and then anterior cervical, posterior cervical, and then supraclavicular. Okay, did you feel any tenderness throughout that? No? Okay, perfect. And then, so now I'm gonna go ahead and inspect the eyes. Firstly, I'm just looking at the eyelids, making sure that there's no like growths or anything. Anything that would like indicate like maybe a sty or something. I don't see anything. And then looking at the sclera, her sclera is white, which is good. And then the cornea, like I don't see anything that would indicate like corneal abrasion, or I don't see any cloudiness, something that might indicate visual problem. And then I'm gonna look at your conjunctiva, so can you go ahead and look up for me? Good, her conjunctiva is pink. Okay, and so now I'm gonna go ahead and test cranial nerve 3, cranial nerve 4, and cranial nerve 6. So to do that, I'm gonna go ahead, I just want you to look at the tip of the pen, and I want you to follow it. Don't like turn your head or anything, just follow it with your eyes. Okay, ready? Good. 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 Okay, perfect. So we can go ahead and assume that those cranial nerves are intact. And then right now I'm gonna go ahead and assess your pupils. So what I'm gonna do here is I'm gonna look, make sure that your pupils are equal size. They're not like misshapen or anything, which is good. There's no like growths into the pupil. And then I'm just gonna check and make sure that your pupils react to light, that they like both consensually dilate and constrict with each other. So to do that, I'm gonna like flash this light into your eyes for like a second or two. Mm-hmm. I just want you to keep on looking behind me, and then I'm just gonna like check. Okay. Ready? Okay. Good, I saw consensual constriction. Perfect. And then now I want you to follow the tip of the pen down to your nose. Ready? Okay, good. She was able to do that, and I saw pupillary constriction as the pen got closer to her nose, which is good. So we can go ahead and say that her pupils are equal, round, and reactive to light and accommodation. And then one more test that I'm gonna do is I'm gonna have you do like a cover test. So I want you to just cover one eye, and then I'm gonna watch to make sure that your eye doesn't move. I just want you to keep on looking straight forward. So cover one eye. Good. Perfect. Now cover the other. Okay, good. And then I didn't see any involuntary eye movement, which is good. So we can go ahead and assume that her eyes are aligned. And then now I'm gonna go ahead and check your ears. So can you go ahead and move your hair for me, please? Just looking at the ears, her ears are symmetrical. They're both the same size, they're pretty even and similar shapes. So I'm just gonna go ahead and assess the ear. Like, look, she has some ear piercings. They look healed. They don't look like bothered at all, which is good. I don't notice like any lesions or abrasions or anything. And then she doesn't have like any growths or like tophi or anything. And I'm gonna check the other ear. This one, same thing. She has some earrings over here. They look like they're healed. Nothing to indicate like infection or anything. And then I'm gonna go ahead and push down on the tragus of your ear. I just want you to tell me if you feel any tenderness, okay?
No.
No? Check it out.
No.
No? Okay, perfect. And then now I'm gonna go ahead and test cranial nerve 8. So to do this, I want you to just occlude one of your ears, and then I'm gonna stand on the other side of you and whisper 3 words. I just want you to repeat it back to me, okay? Ready?
Grass, bad dog.
Yeah, perfect. Now do the other one.
Run, man, fly.
Yeah, good. Okay, so we can go ahead and say that her cranial nerve 8 is intact. So now I'm gonna move on to the nose. Just looking at the nose again, it's in the midline. I don't see anything that would like indicate that she had any like nasal trauma or like a broken nose. Have you ever broken your nose before?
No.
Okay, good. So I want to test the patency of your nostrils. So to do that, I just want you to occlude one of your nostrils and then breathe in and out. So go ahead and do that. Perfect. Now the other one. Good. Okay. And then while we're here, I'm also going to test the cranial nerve 1, which is the olfactory nerve. So I'm going to have you close your eyes, and then I'm going to place something scented underneath your nose, and I want you to tell me what you smell. Okay. Ready? Okay. What do you smell?
Coffee.
Yep. Perfect. Okay. So cranial nerve 1 is intact. Okay. And then so now we're going to move on to the mouth and the throat. So just looking at the mouth, the color is evenly distributed on the lips. I don't see any excessive dryness, no sores or anything, which is good. And then while we're here, I want to go ahead and test cranial nerve 12. So to do that, I want you to stick your tongue out straight. Good. And then now go left, right. Okay, good, perfect. And then I didn't notice any tremors or anything. She was able to do that with ease, and so we can go ahead and assume that.
You can stretch your arms out like this. Thank you. And can you move your hands up and down? Can you move them up like this? Spread your fingers. Good. And can you push down against my hands? Okay. And can you pull up against my hands? Good. And now can you pull your arms towards you against resistance? Pull them. Good. Thank you. All right. So we have full range of motion on the left and the right, and they're equal bilaterally and strong. So full range of motion, equal bilaterally, strong. And next I want to check your brachial pulse and your radial pulse on both sides, the left and the right. So I'm going to feel for your brachial pulse. Brachial pulse is a 2+ on the right. I'm going to feel your radial pulse. It's a 2+ on the right as well. Check the brachial pulse on the left arm. 2+. Radial pulse on the right. Correction on the left arm. It's a 2+. Okie dokie. So I'm going to put 2+. Next, I'm going to ask you to lay on the couch there, and I'm going to check you for the presence of jugular venous distension. Okay, I'm looking at the left side of your neck, and I don't see no venous jugular distension. I'm checking on the right, and I don't see no venous jugular distension. Okay, I'm going to come around and get my chair. I'm going to check your abdomen. Okay, the next thing I want to do is check your abdomen. The contour looks flat, symmetric. I don't see any bulging, any masses. The umbilicus is inverted. I don't see no pulsations occurring in the abdomen on inspection. No bulging, no pulsations, no mass. Now I'm going to check your bowel sounds in all 4 quadrants. Let me see if I can get a better view here. Let me move this around. So I'm going to check your right upper quadrant. Right lower quadrant. Bowel sounds are present as well, normal active. Left rectal quadrant. Bowel sounds are present, normal active. Left lower quadrant. Bowel sounds are present, normal active. Now I'm going to start doing some light percussion and let me know if there is any tenderness as well. So I'm going to check for tympani.
No.
Any tenderness?
No.
Any tenderness when I push down?
No.
No tenderness on all 4 quadrants. All 4 quadrants are tympanic. Next, I'm going to do some deep palpation. And do you feel any tenderness?
No.
It feels soft. Right upper quadrant is soft. Left upper quadrant is soft. Left lower quadrant is soft. Right lower quadrant is soft. No masses are felt and no tenderness reported by the patient. Next, we're going to move on to, if I can get this page flipped, to the lower extremities. We're going to check for symmetry, skin characteristics, and hair distribution. So apparently, currently the hair, there's no hair on their legs. The lower extremities look symmetrical. There's no cyanosis, no ulcers, no pallor, no erythema, no varicosities, no lesions observed. Okay, so now I'm going to check your toes for any clubbing. I don't see any clubbing in her toes. I am going to check the cap refill of her toes. I'm going to squeeze here, less than 2 seconds. Less than 2 seconds. Okay, we're doing good there. And now I'm going to check for pre-tibular edema. No pre-tibular edema. Your skin is warm on the left and the right and dry. Okay, dokie. The next thing I want to do is I want to check your pulses of your lower extremities. So I'm going to check the femoral pulses. Left femoral pulse is a 2+. Right femoral pulse is a 2+. Going to check your palpate pulse. +2. The right palpate pulse is a 2+. Then I'm going to check your posterior tibial. I feel a 2+ in your posterior tibial on the left, posterior tibial on the right, 2+. Going to check your dorsalis pedis on the right, 2+. Dorsalis pedis on the left, 2+. Okay. Moving on to the next section, we're going to check your hip range of motion. So I'm going to ask you to raise your right leg straight up. There you go, 90 degrees. And can you bend it? Good, 120. You can relax. And can you do the same thing with the left leg? There we go, all the way up. If you can bend your leg, perfect. You can lay it back down. And we're going to check for internal rotation. Again, can you bend your knee here? And can you move it inward? There you go. And outward again. Good job. And can you straighten out your leg? All right, can you do the same thing with the left leg? Okay, rotate it outwardly and inwardly. Okay, dokie. And that's it. You can lay your leg straight out. Did you, let me see if, I'm also going to check your hips to see if there's any pain or tenderness or crepitation. So they're going to check for stability. Okay, I'm squeezing. Do you feel any pain?
No.
Okay. No crepitus, no instability, no tenderness, no pain. Okie dokie. So let me check these off. Okay, so, and now we're going to move on to the ankles and feet. We're going to check range of motion and strength. Okay, so first, I'm going to just palpate your feet. All right, did you feel any pain or tenderness when I check your feet?
No.
Okay. I don't see no ulcers, no redness, no edema, no tenderness, and she mentioned no pain. So I'm going to ask you if you can pull up against my hands. There you go. And can you push down like a gas pedal? Thank you. So dorsiflexion, plantar flexion are on the right are present. And I'm going to check for your version. Can you separate your feet to the sides? Like, there you go. And back to the inside. Good. So we got eversion on the left and the right. Dorsiflexion.